Welcome back. Now we're going to look at the Institute of Human Virology of Nigeria Foundation. It was established in 2004 as an affiliate of the Institute of Human Virology, University of Maryland School of Medicine, Baltimore, in the United States of America. It has grown to become a leading local non-governmental organization addressing the HIV/AIDS crisis in Nigeria through the development of infrastructure for treatment, care, prevention, and support for people living with and those affected by HIV/AIDS, but has now expanded its services to other infectious and non-infectious diseases, including cancer, tuberculosis, malaria, and other diseases. It's my pleasure to welcome Dr. Patrick Dakum, CEO of the Institute of Human Virology in Nigeria. Good morning, Dr. Dakum. Dr. Dakum, can you hear us?
Good morning, Alero, and good morning, Nyota.
Morning, and thank you for joining us. Now, in a nutshell, can you just tell us what the Institute is all about?
Well, in talking about the Institute, one can look back to the early and mid-90s when the discoverer of the HIV virus, Professor Robert Gallo, sent one of his postdocs in the person of Dr. Alashley Abimiko to define the subtypes of HIV that was circulating in Nigeria. No sooner had she arrived than she realized that you know, the burden of disease was such that you couldn't just carry out just a research, but that you've got to also provide counseling and testing then. In 2004, the University of Maryland got a grant that enabled it to participate in the U.S. government-led efforts through the Center of Disease Control to provide support to the Nigerian government to mitigate AIDS prevention, treatment, and care. And I think that's the birth of the Institute of Human Virology Nigeria. And at that point in time, the Institute, we decided, will be established as a going concern that will not just be a project-based institute, but an institute that is going to continue to become a veritable partner to both public and private establishments in the area of HIV/AIDS support. Well, like you will know that one of the effects of HIV in a human body is reducing the immunity, and therefore other diseases come to play because you become vulnerable. And so we have tuberculosis was the next issue that we had to grapple with in managing HIV. And I think we've done quite a bit in not just providing support for HIV, but for TB and also for malaria. Currently, we are anchored around three main, I would say, pillars. One is a center that provides support for implementation. And implementation is support for services, infrastructure, and also capacity for healthcare workers. Then we have the other leg that focuses specifically on health system strengthening, and then, of course, long-term training. And then we have the third leg, which is what we are now consolidating towards our future, and that is research. And that's why now we are focused on trying to consolidate on what we have started in terms of participating with the Nigerian research community in HIV/AIDS, TB, malaria, and also non-communicable diseases like the cancers, with other partners to ensure that we provide the necessary partnership and support needed to push this forward. So in a nutshell, you can say we are all about services for diseases of public health significance. We are about capacity building, and we are about research. And all this we do in partnership with both public and private establishments, including their communities.
Okay. You represent, well, you do work with some centers like the HIV, TB, malaria, cancer, and other infectious diseases. I was going to ask you what's the impact of what you do with these centers on the Nigerian health sector, but let's tie it up with the kind of laboratory services you provide as well in terms of what variety of tests and translational researches do you do here in Nigeria?
In terms of our support to health facilities, I think we start with the tertiary health establishments. We have provided support to close to about 12 university teaching hospitals, and then close to about 200 or 300 secondary health facilities, and quite a lot, over 1,000 primary health care facilities. And when we say support, what are we talking about? First of all, infrastructure. Infrastructure, you will find out that especially for primary health care centers, and even to some extent tertiary health establishments, basic, building a lab or making sure that you have the necessary space that is required for clinic care is very important, and we provide the funding required to do this. Secondly, we talk about equipment. A lot of hospitals do not have the necessary tools for diagnosis and for monitoring of these diseases, and we provide that. And then, of course, we talk about building the skills of the healthcare workers in this respect. Now, in doing all of this, of course, you will have to do it with the concept of ensuring that the quality of what you are providing is of a global best practice. And that is why for each of the services that we support, we follow it up with a proper quality mechanism. For the clinic, we have continuous quality improvement teams. In the laboratory, we have, a quality improvement program that seeks to look at reproducibility of results, and also the environment that the lab is situated. Let me be specific on the labs that we have supported over the years. I think one of the key flagship we will make reference to is our biosafety level 3 TB culture lab, which provides liquid culture for tuberculosis. I think it's just 1 out of 3 in the country, and one that has been continuously functional in the country. And it also provided a huge support for doing the surveillance in this country to find out how many people in Nigeria do have tuberculosis, that they are resistant to the common drugs that are being used and will require to be placed on a different treatment. The other is in the area of HIV, where we have provided molecular diagnostic facilities. First of all, to be able to do what we call polymerase chain reaction, PCR, detecting the virus in the blood for HIV, quantifying it, and then looking at how you can use that to monitor patients that are on HIV treatment. And then, of course, we have the gene sequencing lab in Asokoro here in Abuja, where we provide gene sequencing, looking at the resistant patterns for HIV viruses. And this is apart from the routine labs all over the country that we have provided support for, both in equipment and also in capacity of the healthcare workers.
Where is this TB lab? Where is it located?
We have this TB lab in a city called Zaria. It's in a village called Saye. It's located within the National Tuberculosis and Leprosy Training Center. And you will see that this support that we provided is always integrated so that it will also be sustainable. For instance, this TB culture lab in Zaria, most of the people that are working in this TB culture lab are staff of the laboratory unit of the National Tuberculosis and Leprosy Training Center. And our staff are also there providing the technical support and ongoing quality monitoring. But we also, with funding from the Global Fund, are providing support to about 6 other molecular labs that provide TB culture. And one of those is the one located in Naima in Lagos. We have in 4 other places across the country.
Okay. What monitoring and evaluation system do you have for the implementation of your programs?
Well, if you talk about monitoring and evaluation, first of all is at the site level itself. So when you establish a system in a place, if you don't get the people that are working in that place to be the monitors of what they are doing initially, you miss the mark completely. Having external monitors come is an add-on. But if those that are working there are the ones monitoring themselves, you have the first layer of monitoring. So if you go to the lab, for instance, you have got the lab scientists there They have set up a monitoring team where they have panels that they carry out monitoring on a periodic basis. Then we have an external quality monitoring team that goes to these labs and carry out activities using a protocol that already has been approved by the Federal Ministry of Health and also the Laboratory Registration Council. Now, Medical Lab Science Council. Then you do have also the electronic system of monitoring, whereby in the clinics we have data that is produced, number of patients, what drugs they are on, and we get these reports on a monthly basis, and then using and keying it into what the Ministry of Health will call the District Health Information System, DHIS. This is an electronic monitoring system, and we have established what is called an open medical record system that keys into this. Now, data is generated. This data is analyzed at various levels. First at the site level, then at the state level, then at the federal level. And using this, you are able to identify areas that require specific intervention, and you go in and then you intervene. So these are some of the ways that we monitor these programs.
It seems that research is a major part of the work that you do. Where do you get your financing from?
Well, you see, when people talk about research, sometimes they look at it as something that requires a lot of money. But research that we have been carrying out starts from a very simple operational and observational research to, of course, the complex research that requires funding. Let me give an example. While sitting and waiting, I started thinking, wow, I could do some research even in channels here, looking at waiting times, looking at schedulings, etc. And I remember that when we went to Gwagwalada Hospital, we were looking at patients waiting from morning till evening just to pick up drugs. And then we started thinking, we should carry out a research and find out if there's something we can do to solve this. And we carried out a research that became the evidence required for the Federal Ministry of Health to carry out what is called task sharing within these clinics that reduced waiting time. We also are carrying out, of course, the higher level research that goes on to looking at the genetics of human beings and how that is a determinant for various kinds of diseases. And it spans across cervical cancer, molecular determinants for that. And so it's not as if it's just the basic ones. But to answer your question, Alero, very directly, we have been getting the funding for research specifically from the National Institutes of Health. Of course, we also have been carrying out research in partnership with the Center for Disease Control, which is based in Atlanta. And then the Global Fund also has provided some funding for us to be able to look at how treatment for TB can be shortened for those that are on MDR TB, and we are currently carrying out those researches.
Okay.
Now, from the National Institutes of Health also, we have been able to be part of what is called the Human Heredity for Health, and we have Professor Alashle Bimeko and Professor Clement Adebama that are principal investigators working on establishing a biorepository here in Abuja that is going to be a repository for specimens across West Africa for researchers. And then, of course, a collaborative center for microbiome that looks at, the molecular structure of we as humans and how that becomes a determinant for disease and how we use this to prevent diseases.
Dr.
So,
Darkom,
in effect, funding has been coming mainly from external donors.
Dr. Darkom, what you do sounds really inspiring. Do you operate all over Nigeria? And if someone's looking to meet, to partner with you, how can they reach you?
Well, currently we work in about 22 states, and we have specific offices in about 8 states now. And you can definitely reach us through our website, www.ihvnigeria.org. You can also interact with us on Facebook, on Twitter, and these are all avenues where you can find out about what we do, how to contact us, and how to partner. In fact, what we are even moving forward is in consolidating our research to have a fundraising next week that we hope to be able to get a center built that will enable us consolidate on this research. And that's what we refer to as the International Research Center of Excellence, which is a center of the Institute of Human Virology. And we hope that we will be able to now provide that, facility that will provide for laboratories, training, and also partnership across public and private establishments.
Thank you very much. Dr. Patrick Dakum, Chief Executive Officer, Institute of Human Virology of Nigeria. Thank you very much for coming to tell us about virology. I think we're now better educated. Thank you, Doctor. Sunrise will be back.
Thank you, and God bless you all.
Sunrise will be back in just a moment with the home stretch that Nyota has been looking forward to because we have a very interesting guest coming in.
Yes, indeed.